Since taking office, President Trump has repeatedly promised that he would, quote unquote, make America healthy again. He said he is, quote, committed to restoring a gold standard for science. He claimed that, quote, we have made tremendous strides in cancer research, far more than anyone has done. He promised to stop pharmaceutical companies from, quote, getting away with murder, end quote, by ensuring that Americans pay the lowest prices in the world for prescription drugs. In August, Trump said he would fire, quote, every single one, end quote, of his top officials if they did not, quote, have drug costs that drop like a rock. Well, Mr. Chairman, has President Trump lived up to the promises he made to the American people? Has he been telling the American people the truth? And the answer, obviously, not surprisingly, is not that he lies all of the time. Trump's so-called big, beautiful bill made the largest cut to Medicaid in American history. When you throw 15 million people, low-income and working-class people, off the health care they have, people die. And there are studies out there that 50 or 60,000 Americans a year will die because they're no longer able to get to a doctor when they should. I don't think you make America healthy again when you provide a death sentence to 50 or 60,000 Americans. And that's not all. For generations, and the chairman touched on this, American families facing cancer, Alzheimer's, diabetes, and heart disease have looked to the NIH for hope. They have relied on NIH-funded research, basic research, for new treatments and cures. And yet, while Congress fully funded NIH, the Trump administration has made the deliberate policy choice to terminate grants mid-study, abandon patients in clinical trials, and driven a generation of scientists to question whether they can conduct serious research in the United States. And according to a new report that I am releasing this morning, instead of making, quote, tremendous strides in cancer research, end quote, the NIH has terminated or frozen $273 million in cancer research since Trump was inaugurated. The chairman talked about how all over this country, people with serious illness are looking for hope. They want breakthroughs. They want to know if they will survive cancer. Trump administration, NIH, has terminated $273 million in cancer research. But it's not just cancer research. In total, the NIH has terminated or frozen at least $561 million in research and defunded more than 300 clinical trials dealing with heart disease, Alzheimer's, diabetes, dementia, and pediatric brain tumors. Moreover, instead of substantially reducing the price of prescription drugs, something that I have worked on for years, everybody here has worked on, everybody here knows that 1 out of 4 Americans cannot afford the prescription drugs they need. We have all talked to pharmacists who have told us that people walk into the drugstore with a prescription and they're shocked by the price they have to pay, and they can't pay for that. So instead of substantially reducing the price of prescription drugs, as President Trump promised, the prices of more than 870 prescription drugs have gone up, not down, this year alone. And relevant to this hearing, the price of every single drug invented with the help of NIH scientists is higher in the United States than it is in other countries. Here are just a few examples. These are drugs developed, basic research done by American taxpayer dollars through the NIH. Johnson & Johnson charges Americans $57,000 a year for the HIV drug, so I may be mispronouncing this, Simtuza. That same exact drug costs $11,000 in the UK, $57,000 in America, $11,000 in the UK, $9,000 in Japan. Gilead charges Americans $504,000 for the cancer drug Yescarta. That same drug cost $266,000 in Germany, half the price. Bristol-Myers Squibb charges Americans $544,000 for the cancer drug Apokma, while that same exact drug costs $394,000 in China. Bottom line is we pay for the research, drug gets developed, other countries charge substantially less to their people than we do we pay in this country. Mr. Chairman, the American people are sick and tired of paying by far the highest prices in the world for prescription drugs. People are dying because they cannot afford those prices. We need real action to take on the greed of the pharmaceutical industry and substantially reduce the cost of prescription drugs for all Americans, not more lies and phony press releases from the White House. Several months ago, I introduced legislation that would cut the price of prescription drugs by more than 50% by making sure that Americans don't pay more for prescription drugs than Europeans or Canadians. Not a hard proposition. See what they are paying, what Canadians are paying, what Europeans are paying. We pay the same rate. That will lower prescription drug costs in America by half. President Trump and his administration were serious about lowering the price of prescription drugs. They would support this bill.